When we hear the term PTSD, most of us immediately picture a very specific archetype, a soldier returning from a combat zone. But treating trauma as a strictly military condition leaves out millions of people. Civilians who experience severe psychological aftershocks often dismiss their own flashbacks and jumpiness as a personal weakness, rather than a physical medical reality. A sudden violent collision on the highway is one of the most common catalysts for the condition. A terrifying medical emergency or severe complications in the delivery room can trigger the exact same biological response. First responders also face compounding daily crises that force their nervous systems into a constant state of high alert. This chart illustrates the broad scale of the issue. The lifetime prevalence of PTSD in the United States hovers near 6%, with distinct statistical spikes among elevated demographic groups like women and first responders. Society frequently brushes off these everyday traumas as standard stress. The result is that millions of people carry the weight of a definable medical condition in silence, unaware that their specific symptoms are clinically recognized. To separate a temporary stress reaction from a clinical disorder, clinicians look at exactly how long the symptoms last. Looking at this timeline graphic, any immediate reaction to a traumatic event is classified as acute stress. It only crosses the threshold into post-traumatic stress disorder if those intense symptoms persist for more than 1 month. You cannot establish that threshold through internet quizzes. A structured assessment by a licensed clinician is the only way to accurately confirm the condition. That formal evaluation is required because PTSD shares symptoms with panic disorders and dissociative conditions. Pinpointing the exact diagnosis is what allows therapists to identify the specific targets needed for a professional treatment plan. Clinicians break down the architecture of PTSD into 4 distinct symptom clusters. The first is intrusion. These are the unwanted memories, nightmares, and intense physical reactions that pull a person violently back into the traumatic moment. The second is avoidance. To protect themselves, patients alter their routines to dodge anything that reminds them of the event, deliberately skipping certain locations or entirely shutting down specific conversations. Next is negative changes in mood and cognition. This presents as an emotional numbness, a persistent sense of self-blame, and a heavy detachment from the people and activities they once loved. Finally, there is hyperarousal. The brain gets locked in a state of exhausting hypervigilance, leading to exaggerated startle responses, irritability, and severely broken sleep. These 4 pillars function as a neurobiological trap. They keep the mind and body physically anchored to the past, long after the actual threat has disappeared. Despite the complexity of that loop, PTSD is highly treatable when matched with the right evidence-based protocols. Clinical researchers have developed specific, empirically supported therapies to dismantle the trauma response. Methods like eye movement desensitization and reprocessing, cognitive processing therapy, prolonged exposure, and trauma-focused CBT are designed to resolve these symptoms at their source. In some cases, FDA-approved medications like sertraline and paroxetine act as vital medical support systems, stabilizing the nervous system while the behavioral therapy takes place. These protocols succeed because they don't just temporarily mask emotional pain, they systematically break down the 4 symptom clusters that keep the condition active. For Georgia adults carrying the weight of these experiences, Coping and Healing Counseling is a specialized resource for accessing these specific treatments. They operate a 100% HIPAA-compliant telehealth practice that reaches all 159 Georgia counties, completely removing geographic barriers to getting help. Their culturally competent, diverse team of licensed therapists specializes in the exact evidence-based trauma protocols we just covered. They accept major insurance networks, including Aetna, Blue Cross Blue Shield, and Cigna, and offer a $0 copay for Medicaid patients. Trauma does not have to be a life sentence, and struggling with its aftermath is not a weakness. Professional, accessible healing is real, and it is just a call away.